Friends, today we will learn about non-tuberculous mycobacteria. Under this, we'll study about classification, culture, different groups, group 1 photochromogens, group 2 scotochromogens, group 3 non-photochromogens, and group 4 rapid growers. Then we'll study about epidemiology, clinical manifestations we'll study. Next we'll study about localized cervical lymphadenitis. Then we'll study about pulmonary disease, then skin lesions. Next, we'll study about laboratory diagnosis. Next, specimens and microscopy. Then, culture, biochemical reactions and treatment. So, let's begin. Mycobacteria other than tubercle bacilli that may occasionally cause human disease resembling tuberculosis have been called atypical mycobacteria. They are also named as anonymous or unclassified mycobacteria. They normally exist as saprophytes of soil and water. They occasionally cause opportunistic disease in man and hence are also named opportunistic mycobacteria or non-tuberculous mycobacteria or mycobacteria other than tubercle bacilli, in short MOTT. The name non-tuberculous mycobacteria, in short NTM, has been accepted widely in recent years. They are non-pathogenic for guinea pigs. There is no evidence of direct transmission from man to man. Some of them cause pulmonary disease indistinguishable from tuberculosis, while others are encountered in association with lymphadenitis, abscesses, urinary infections, and cutaneous lesions. The non-tuberculous mycobacteria are the most common cause of cervical lymphadenitis in children in Britain. The infectivity of non-tuberculous mycobacteria is much less than that of mammalian tubercle bacilli. They are resistant to antituberculous drugs, particularly streptomycin and INH. Now let's study about the classification. On the basis of pigment production and rate of growth, Runyan in 1959 classified non-tuberculous mycobacteria into four groups. These include group 1, group 2, group 3 and group 4. Group 1, that means photochromogens, group 2, that is scotochromogens, group 3, that means non-photochromogens, and group 4 rapid growers. Runyan's classified is classification is universally accepted. Species identification is made by several additional characteristics. Now let's study about the culture. Non-tuberculous mycobacteria (NTM) grow in Lowenstein Jensen medium. They also grow in the presence of p-nitrobenzoic acid, that is in short PNB, 500 microgram per ml. This features differentiates NTM from M. tuberculosis, which do not grow. Colonies appear within 2 to 3 weeks except in case of rapid growth. In case of rapid growers which produce colonies in 4 or 5 days, photochromogens form colonies that produce no pigments in the dark, but when colonies are exposed to light for 1 hour in the presence of air and re-incubated for 24 to 48 hours, a yellow-orange pigment appears. Pigment is chemically beta-carotene. The scotochromogens produce pigment in the dark. Non-photochromogens do not form pigment even on exposure to light. Rapid growers may be photo, scoto, or non-photochromogens. Now let's study about the different groups. Group 1, photochromogens. They produce pigment on exposure to light as described earlier. They are slow growing, though the growth is faster than that of tubercle bacilli. This group contains M. kansasi, M. marinum, and M. simei. M. kansasi causes chronic pulmonary disease resembling tuberculosis, particularly in old persons with pre-existing lung disease and with impaired immune responses. Man-to-man transmission is not known. The bacilli have been isolated from soil, water and milk. They grow well as at 37 degrees centigrade on LJ medium and produce yellow-orange pigment. They are usually sensitive to rifampicillin and other anti-tubercular drugs. M. simi was originally isolated from monkeys and like M. kansasi, it grows well at 37 degrees centigrade and principally isolated from pulmonary lesions. It synthesizes niacin in significant amount and may thus be confused as M. tubercle. M. marinum grows poorly or not at the 37 degree centigrade but grows well at 33 degree centigrade. It is the causative agent of superficial granulomatous skin disease of man known as swimming pool granuloma or fish tank granuloma. Disease is acquired through water. M. marinum resembles M. kansai in many respects but can be differentiated from M. kansai by first point is its poor or no growth at 37 degrees centigrade, its failure to reduce nitrate to nitrite. Third point is its failure to produce catalase. Fourth point is its ability to hydrolyze pyrazinamide. Now let's study about the group 2 scotochromogens. Scotochromogens. These chromosomes produce pigment yellow, orange or red in cultures incubated even in the dark. They are saprophytes found in the environment. Only one number of this group, M. scrofulaceum, causes scrofula in children. M. gordoni is often found in water and is a rare cause of pulmonary disease. It is a common contaminant of clinical specimens. M. sulgai is a scotochromogen at 37 degrees centigrade and photochromosome at 25 degrees centigrade. It may occasionally cause pulmonary disease and bursitis. Now let's study about group 3 non-photochromogens. Non-photochromogens do not form pigment even on exposure to light. The medically important species include M. intracellular, M. avium and M. xenopi. M. intracellular is also known as Bacillus, as it was first detected at the Batte State Hospital for Tuberculosis in Georgia, USA. It causes chronic pulmonary disease indistinguishable from tuberculosis. The organisms occur in soil and water. Rifampicin with streptomycin is used for treatment. M. avium causes tuberculosis in fowls and sometimes in pigs. It may cause pulmonary disease in immunocompromised patients and cervical lymphadenitis in children. It is so much similar to M. intracellular that they are usually grouped together as M. avium intracellular complex, in short MAC. M. avium can grow at 45 degrees centigrade. M. avium intracellular complex, in short MAC, possesses 28 agglutination serotypes. Types 1, 2 and 3 are regarded as M. avium and Types 4 to 28 are M intracellular. In man, this complex causes pulmonary disease indistinguishable from tuberculosis, lymphadenitis, and disseminated disease, particularly in the AIDS patient.